Hi, I'm Kat Dolby-Welsh. I'm the lead for Complex Care and the Clinical Director for Yeovil Primary Care Network. The Complex Care team is a resource that grew out of the Vanguard Symphony project. In March 2018, we started working more directly with the community teams and with primary care and acute care, trying to knit together the different plans and information about people with complex health needs. Complex Care team is made up of GPs, nurses and key workers and can provide a tiered level of support to those individuals with complex needs. For instance, a complex care GP may give a medication review, may spend time more than the 10 minutes that is given in primary care, really getting to understand and contextualise the problems that people with complex health needs have. The nurse may go out and work with the social worker, district nurses and mental health teams to help the patient, the carers, the person understand what it is that they need to be able to have a better quality of care in the place or quality of life in the place that they're based in, that they prefer. That might be a care home, that might be their own home. They might have capacity, they might not. Key workers are able to then spend more time with the patient on a more regular basis, ensuring that the person at the centre of all this is really getting the care that they wish. So the bulk of the complex care work, the information gained, is through meetings with GP practices. We work with 19 practices across South Somerset through meetings that we call huddles. In these huddles, there may be the complex care team, the GP, health coaches, and outside community health members may come in at the same time. And we really share information to be able to come up with a sustainable plan of care.
Hi Kat, I've been to see Mr Jones the other day and I'm really concerned about him. Is there anything you can help me with? Because obviously he came in, he broke his hip, he's had some rehab and now he's gone home, but he's just not managing as well as he could be, and I just didn't know what other support we can offer him.
And was he on a pathway?
He was, yes.
Pathway
1.
Finished.
Yes,
oh,
and that's
right,
finished,
okay.
yeah.
So what kind of things were you concerned about?
Just that he doesn't feel he's doing as well, his appetite has gone off, he feels that he needs a little bit more physio, maybe OT. He's still working with the Zimmer frame, even though he feels confident, he feels that he could do with a bit more progression.
And is he isolated on his own?
Yes, he sort of lives middle of nowhere. It's really difficult for him to get to the GP surgery and access things like that, so yeah.
And he's a South Somerset GP?
He is indeed, yes.
Okay, so what we can do is bring him to our huddle meeting with the GP and speak with the GP and the health coach to see what their knowledge is of him. I'll have a look on Rio, on his community notes, and see if there are any other community teams that have been involved. And does he have a care? He didn't end up with a care package after Pathway 1?
No, he didn't, no.
Okay, so we can look at that of what needs. So I'll go back and see what the Home First end of pathway assessment was. Do you know if he's self-funding?
I don't know off the top of my head, no,
okay.
I'm sorry.
Well, that's really helpful because, of course, bringing the conversation about him alive in the huddle is how we can all join things around him.
Yeah, no, that'd be great. Thank you ever so much. That's ace.
Our aim for this week is to show to the teams within YDH what depth of information and the scope of care that we can help different teams provide. So if you see someone in a purple t-shirt, really do feel free that you can go up and say, actually I've got a patient that I'm really concerned about, they've got complex health needs, they've got long-term conditions. There are a number of different teams that are involved with them in primary care, in acute care and in the hospital. They really need some help with understanding how that information all fits together.